Good afternoon, everyone. We are here in Milan at the GISE conference. My name is Valeria Paradies, and I have the pleasure to have here Professor Granada. He's the president and CEO of Cardiovascular Research Foundation, and I have Professor Kirtane. He's the professor of medicine of Columbia University Medical Center. So we had today a great session. You are both co-director of TCT course, and we had today a joint TCT GISE session. So we talk a lot about precision medicine, remote control of data, remote acquisition of data, remote treatment of patients. But my question to you would be, how do you see the integration and adoption of precision medicine in actually the workflow, in our workflow as interventional cardiologists?
So, first of all, thank you for the invitation. I mean, it's a great pleasure to be here with all of you. You know, one of the things that I kind of like always to make a clarification is when we put these innovation sessions, we don't mean to be cold or impersonal, because it actually looks very futuristic. And I think the idea is actually more to create awareness about what is coming and to be prepared, you know, for the future. I don't know, Ajay, you remember when we started talking about interventional heart failure 5-7 years ago, that people were like, what these guys are talking about, and right now there is a full field with training fellowships and tracks. So I think it's important to actually speak about this, because these changes actually will come. And technology right now is moving at such a fast pace of development that very soon we're going to see companies that are providing services to gather data at home, to do echoes that exist in the US already, get echocardiography at home, being able to transfer data to the cloud, being able to do reading of virtual CTs. So all these things are coming. The question is, your question, which is very difficult to answer, is how is that going to impact our field? And I know it will impact our field in a big way. First is going to happen, you know, in imaging. And things like a heart flow or examples like that, in which the number of diagnostic catheterizations will decrease, you know, and now we're going to be more interventionally driven rather than diagnostic driven, is one of the big changes that actually we're going to see.
Yeah, I do absolutely agree. And we talked today about the fact that probably the use and the adoption of precision medicine actually can take more of our time, longer of our time. My question is that so? Or do we think that actually pre-procedural planning and prevention of complication actually ultimately impact on the patient care and also on the time that we dedicate to the procedure?
I think what you point out is exactly right. It's better time. In other words, when Juan was talking about, you know, limiting diagnostic caths, it means that we don't just do the same thing for every single patient. We use the efforts that the patients who need it really, they get that, and the ones who don't need it can focus on other attributes. And that's the real point of it. And I actually thought it was a great juxtaposition also of having the PCR session right before, where they were talking about specific problems going deep, and then a futuristic session right afterwards. And we were referencing each other in the sessions as well, which is, I think, this whole part of the spirit of collaboration that's going on.
And one more question, education, that actually plays a really important role. And we have seen simulators and indeed, for example, at the conference. How do you see that happening in the future?
Well, we both, and everybody here is so
Support.
into education and support it. I think we have to be more intelligent about how we do it. There's also a gap. Juan and I were just talking about, there are certain people for whom they're masters and they need a certain level of education or just reaffirmation or tips and tricks just to tweak the technique. And there are other people for whom the technology is completely new and inaccessible because they don't have those basics. And for that, maybe that's where simulation or more innovative educational sessions will come into play to get them up to speed so that then everybody's talking the same language.
And one thing that is important to talk about is we have to be all, you know, humble enough to recognize there are different tiers in terms of the level of knowledge and actually also sophistication, all right? And the idea is to democratize education in a way that a lot of people can get a great education at the same level. Unfortunately, over decades, we kind of trained a smaller group of people to essentially do special procedures, and then the rest would learn as a second-hand training. And I really think it's time to change that because we have right now the educational tools and the infrastructure to be able to elevate the knowledge of many, many people that at the end actually translates in better clinical outcomes. Right?
Exactly. Well, the DES indeed, which stands indeed
Yeah.
for not for
Exactly.
drug-eluting
But a
step.
different DS, yeah.
Fantastic. And yeah, again, it was really a great honor to have you here representing the TCT. How do you see the societal role of in this field? A collaboration between TCT and GISE, gathering data and sharing education. How do you see that?
You know, I think that every society serves as such a vital role, and we talked about it during the session, of really trying to advocate for the patients and the practitioners and bringing those together. So from our standpoint, that's one of the reasons why we really look forward to meetings like this. When you talk about different levels, like Juan, you're Spanish and Italian, you understand Italian very well. I don't understand a lot, so I need Juan to come, to translate for me. But the reality is I think we all grow together. And we learn a lot of new things together. And so from our standpoint, we really value these relationships collaboratively with societies, not just GISE, but beyond, to really help everybody in the space. Maybe one final thought.
Look, honestly, Italy is very important for us for many, many reasons. I mean, it's actually close to our hearts. This is a very special region actually for me for many reasons. And also we've had a long history of collaboration and a long history of friendship. So I think it's important after the pandemic that we actually get this relationship even stronger. And as I always say, you guys know that actually we're always open to help, collaborate, and contribute to all your efforts on every single level.
Fantastic. Well, thanks again, and looking forward to see you again next year at GISE conference.
Sure.
And stay tuned. Bye.